I am so excited to do this next segment right now. So some of us, me included, have a fear of going to the dentist. I do not love it, but there is a new way of getting treated that just might ease those fears. If this doesn't work, I don't know what will. We have Dr. Chris Theodorou who's joining us. He is a dentist who calls in the help of these two to help his patients to ease their anxieties. Thank you for coming in, and
Good
thank
morning.
you for bringing them. We have laser and mercury.
Mercury, correct.
How, first of all, I'm sure that patients, when they see these dogs the second they walk in, it automatically gives them a sense of relief.
Oh, absolutely, totally. And you know, there's statistics and research proven that a dog will calm and lower people's blood pressure, their phobias and everything. It's clinically proven.
And so when they come in, how does it really work? Do the dogs greet them? Do they just come sit on their lap while they're getting treatments done?
The patient will request, you know, I would like to have mercury or laser, and we'll schedule the appointment, and you know, mercury or laser will just come right out. We put a blanket on the patient, and they just jump right in the chair, and they give the patient, it's almost like a weighted blanket, but it's a dog.
So when someone has a severe anxiety, because I know it ranges.
Correct.
I do not like, no offense, I do not like going to the dentist office. I would love coming to you for sure. But there are some people that it is a real fear and a real problem. So how do they sense the difference in some people that might be, you know, at different parts of the spectrum?
So they, you know, it's almost like an innate, you know, they've gone through therapy dog training, and especially laser has that ability. He can sense the heart rate, he can sense the level of fear, he can sense if it's just a patient who just likes the dog, and then the dog will sit on them, and laser will be like, oh, okay, well, you're not really phobic, you just want me to love you. I'll give you some kisses and love, and then I'm done, bye, I'll see you. But if it's a phobic patient, he will stay on the phobic patient for 2 hours if need be.
Wow, they can sense it.
He senses it completely.
And Mercury's in training right now.
Correct. Mercury's in training right now.
Look how cute, though. You make everything better. I don't care what anybody says. You dogs do. So you do some also unique things at your office.
Correct.
That I don't think other dentist offices do.
Correct. We do have a cosmetic laser that we use. We use it with the attachments for dentistry. We also then use it for some mild cosmetic procedures of the face, lip augmentation, wrinkle removal, and some sleep apnea and snoring procedures.
Wow. And then you'll do the typical things.
Correct. Absolutely. Veneers, cosmetics, general dentistry, dentures, partials. We're a full-service general dental office, but we definitely cater to phobic patients. And not just with dogs, but we also have other procedures that we can use, nitrous oxide, sedation. We bring in anesthesiologists. We are here to help someone with a phobia get through it, because, you know, it's important. There's a direct correlation between a patient's health, oral health, and their overall health. More and more research is coming out, and they're finding issues with periodontal disease and heart disease, brain issues. So yeah, it's very important to get someone, you know, into the dentist and get them get their oral health up.
Especially with the pandemic. I mean, I think everyone put everything to the side.
Absolutely.
And especially the ones that you don't always want to necessarily go to. I don't know what it is about the dentist's office that freaks people out. I mean, me included, like I said, but you know, once you're there and you've done it, you realize, I mean, the importance of it is, as you're saying, how it relates to the rest of your body.
Oh, absolutely.
There's a great need to make sure going every 6 months?
Every 6 months at least, yes, absolutely. We have some patients that come every 4. But
or more with him,
or
with them,
more
right?
with them, absolutely. Some stop by just to say hello.
I bet they do.
Yeah, they get treats for the holidays from patients. Patients just stop in and give them stuffed animals. You know, the important thing is we get that phobic patient in, and we work on getting that phobia down and getting them comfortable with us. And it really is an awesome feeling to get that patient to the point where they don't need sedation, they don't need anything. They're fine with just the dogs.
I'm telling you, there's a lot of dentists out there that are probably not going to be too happy with you right now because you just stole their patients. But Mercury, thank you for coming in. You've been so good. You've been such a good. Oh, I can't. He's like, can I go play now? Yeah. Thank you again.
Thank you for having
Appreciate
me.
You. And you're in Strongsville?
Correct, Strongsville.
And what days of the week are you open?
We are open. We're almost a full week. We do our larger cases on Fridays, but it's Monday through Friday.
Okay, Dr. Theodorou, again, thank you for coming in.
Thank you for having me.
Thank you, Mercury. Thank you, Laser. He's like, I'm good.